With so many traveling and gathering for Thanksgiving, what does it mean for the so-called perfect storm of flu, COVID, and RSV going around? Physician at Stanford Children's Health and ABC News medical contributor Dr. Alok Patel is here with more on this. Dr. Patel, happy Thanksgiving to you. I know we woke you up bright and early today, so we appreciate you coming on. We're in that holiday stretch now of family gatherings and travel. So what can we do to reduce our risk of getting sick or getting someone else sick?
Well, Diane, happy Thanksgiving to you. I'm very thankful for you and the entire ABC family for being, on it when it comes to protecting people. And I actually didn't wake up early. I got back from the hospital, and I will tell you, one of the most important things that people can do is paying attention to those early signs of when you're sick, of when you actually have these potential cold and flu symptoms, and staying home and staying away from others. And for parents, one of the most important things to know is what those insidious signs of respiratory distress are, and knowing when to take your child to an urgent care or emergency room.
So walk us through those signs when it comes to children first, and then I want to talk about adults as well.
Absolutely, Diane. So if you imagine a child struggling to breathe because there is so much mucus in those little tubes in their lungs, so you're going to see a fast respiratory rate. Children are breathing very quickly. They're gasping for air. They're doing all the work with their chest muscles to try to move air. Those are those signs of respiratory distress where children need medical care ASAP.
And we've talked a lot about the surge in RSV hospitalization for children, but the CDC now says RSV hospitalization rates in adults, in older adults particularly, 9 times higher than they were 2 years ago, nearly double what they were last year. So how do people know if they have RSV, right? When is it just a cough? When is it RSV? And how do you know when to go to the hospital?
You may not know. In those early signs of having a cold, it's actually very difficult to tell what potential virus you may have. You may not need to know. If it's influenza or COVID-19, yes, there are antivirals you can take. There are tests you can take that are important to know not only that you're sick and you need to stay away from others, but also something that can reduce your symptoms. But as far as the other cold viruses, it's more important just to know, hey, I'm getting progressively worse. I need to seek medical care. And I'm glad you brought up those numbers about older adults being hospitalized as well. Anyone who has underlying cardiac, heart, or lung disease is also at an increased risk. It's not just those little kids that we're seeing flooding the emergency departments right now.
Is this what we should expect now for the rest of the winter, essentially, or is there any sense of this surge easing?
I hope that this is not what we're going to expect for every winter, Diane. There is some promise in 2023 about new treatments for RSV, including a monoclonal antibody, but also potentially, and knock on wood if it's near you, a vaccine for the elderly, for pregnant women to start in vaccine trials for children. And I will tell you, scientists have been looking for an RSV vaccine since the 1960s. It's been elusive. If and when we get a successful and efficient one, we're going to save thousands of hospitalizations and hundreds of thousands of lives worldwide.
Awesome. Now, earlier this week, Dr. Fauci urged Americans to get their COVID-19, their updated COVID-19 booster. So what do we know at this point about the booster, how effective it is, and how do you know if you're eligible?
Well, Dan, one of the most important things that we saw about the bivalent booster was earlier releasements from the pharmaceutical companies that they boost antibody levels, which should translate to more protection, but there wasn't a lot of peer-reviewed studies on it. But then the CDC released information saying that, hey, these bivalent shots are about 50% efficacious against infection, but that includes mild or asymptomatic infections. So against severe illness, which is what they're designed to do, that number should be way higher. And in terms of being eligible for that, it's all about making sure that you have your primary series done first, and then you wait a couple months after that. And if you've recently had an infection or you have any other questions about your timing, it's important to chat with your doctor or healthcare provider.
All right. Dr. Patel, it is always great to have you, and we appreciate you on Thanksgiving and all the time.
Likewise, Diane. Thank you.
Take care.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.